The treatment for some types of blood cancers can include powerful chemotherapies that have kept patients in hospitals instead of at home. But as Doug Johnson explains, doctors are increasing outpatient care as a way to keep people well beyond the diagnosis.
Nearly every day, people with cancer are receiving chemotherapy. With leukemia or other types of cancer that affect the blood, patients often have to stay in a hospital for sometimes lengthy treatment.
It's really for two reasons. One is that the patient's, the disease itself is very aggressive, and because of the aggressive nature of the disease, the patients are usually pretty ill and require frequent monitoring, which is usually done in the hospital.
But hematologists with the Boston Baskin Cancer Foundation at Baptist Memorial Hospital are trying to encourage more outpatient care, not only for patients with leukemia and lymphoma, but for those who have had bone marrow transplants as well. That means treatment in a clinic without a long stay.
Patients are, when they are close to their family and at home, they feel better. They are more motivated to participate in some of these complex treatments. And overall, if you look at transplant outcomes, they are better in the outpatient setting.
That can be because of the risk of hospital-related infections. Those infections can be severe and difficult to treat, which is why doctors want to prevent them. And having people stay at home has an additional benefit. It can force people to be more active, and activity is often associated with better outcomes.
As our ability to follow these patients and track them in an outpatient clinic gets better, we're hoping to move towards moving their main phase of treatment to the outpatient setting. So while they'll be initially diagnosed in the hospital and probably start their treatment in the hospital, as they get better, they can move to an outpatient setting.
And Dr. Gurha adds that the ability to track patients outside the hospital is improving, which allows doctors the ability to spot potential problems.
Traditionally, we have kept the patients in the hospital after we are done with the chemotherapy to monitor for side effects, but now with advancements in the way that we can deal with these patients as an outpatient, we're trying to discharge them home after their initial treatment just to follow up as an outpatient.
The most aggressive diseases can still require in-hospital treatment, and doctors are careful about the patients they recommend for treatment on an outpatient basis.
Some of the factors which we look are how far they are living away from the transplant center. Do they have a reliable means of transportation? If something happens to them, they should be, within 15 to 20 minutes drive. And if patient is motivated and is compliant, I think that when we do outpatient transplantation, outcomes are better.
The hope is that an increasing number of patients will have those better outcomes from receiving their chemotherapy treatment on an outpatient basis. For Smart Medicine, I'm Doug Johnson.